More breaking news on the COVID-19 vaccine. A CDC advisory panel has followed the FDA's lead and recommended booster shots for millions of older and at-risk people who received the Pfizer vaccine. Earlier today, Rhode Island's vaccine subcommittee discussed what the booster rollout would look like. 12 News reporter Brittany Schaefer listened in on the meeting and continues our coverage with what she learned.
Putting a plan together to implement boosters.
Rhode Island will likely begin giving booster shots this weekend beyond immunocompromised people.
If we have guidance this week, the goal would be to begin administering those vaccinations this weekend.
And the CDC's guidance backing Pfizer's booster for older and vulnerable Americans was announced just over an hour ago. Earlier today, the Department of Health's COVID-19 vaccine subcommittee voted in favor to proceed with their plan for booster shots following CDC guidance.
The vote today was to go ahead and implement that final recommendation and guidance that comes out from the CDC.
The CDC's recommendations approved Pfizer's booster for people ages 65 and up, adults aged 50 to 64 with underlying health conditions, and people who work in high-risk environments like grocery stores, schools, prisons, or first responders. Health Department data shows those requirements cover around 130,000 Rhode Islanders.
We want to get these out as quickly as possible.
The third shot would be given 6 months after eligible residents received their second shot of the Pfizer vaccine. Executive Director of the state's COVID-19 response team, Tom McCarthy, tells us pharmacies are expected to administer most doses while also offering a targeted effort for congregate care settings, correctional facilities, and communities of color.
That's been one of the most successful parts of this campaign, put those vaccines in people's paths, and that's what's allowed us to, fortunately be in a relatively good position for the Delta variant. We're always preparing for what could potentially come next, and continuing to get as many people vaccinated as possible is critical.
And the FDA is still reviewing booster shots for people who received either the Moderna or Johnson & Johnson vaccines. McCarthy does say the state is increasing staffing at call centers in anticipation of more people calling to make appointments. In Providence, I'm Brittany Schaefer, 12 News.